Hello, welcome to our town hall today to learn more about the COVID vaccine. The information that we have today is up to date for today, March 17th, 2021.
欢迎各位参加我们这个 Town House 我们的这个病毒的新消息呢，都是最新的，现在是3月17号2021年的消息。
And we have Dr. James Darnton, who will be leading us today.
Jim Darnton 医生呢，会带领我们今天的这个课程。
Go ahead, Dr. Darnton.
Hello, everybody. It's a pleasure to be here at our COVID vaccine town hall.
我是 Larry 刘，我是翻译。这位Darnton医生，他很高兴欢迎各位。今天是我们的病毒的这个 Town House 的分享。
I'm a primary care doctor at Harborview Hospital in Seattle at the Adult Medicine Clinic. And see a lot of patients who are having questions about the COVID vaccine.
我是成人科的家庭医生，我知道很多病人有这方面病毒这个方面的这个问题。
So I'm very pleased to bring some information to this group today, and please don't hesitate to ask specific questions that I don't cover in my general introduction.
所以我很高興做這個報道。如果各位有什麼問題的話，這個不要客氣，盡量提出來。
Great. And as Yvonne mentioned, things are developing very quickly, and the information I'm going to provide is up to date for now, but things might change in a week or two, or even in a few days. So it'll be important to stay up to date on recommendations.
以往刚刚也提到说，我们这个消息很快很迅速，所以虽然现在是最新的消息，但是1-2天之后或者是1-2个月之后都会有变化，所以希望各位能够保持这个最新的资讯。
Right now, through really a miraculous mobilization of resources around the world, we have 3 authorized vaccines in the United States for COVID-19 disease.
经过全世界大家的共同努力呢，我们有这个很好的成就。现在我们在美国呢，有3个已经被认可的这个病毒的这个预防。
These vaccines, one is made by a company called Moderna, another by a company called Pfizer, and another by Johnson and Johnson.
这个3个疫苗呢，其中一个是 Moderna 公司，另外一个呢是 Johnson and Johnson， 另外一个是Pfizer 公司。
There are some differences between the vaccines that we can get into, but I think it's important to start by saying that all 3 are effective vaccines.
这个3个疫苗呢都有点不同，但是我们也可以说呢，它们都是很有效的。
They are effective in reducing the number of people who develop symptomatic disease symptoms from COVID-19.
这个有效性是减少这个新冠病毒所造成的这个身体的病状。
And they're incredibly effective in the studies at preventing severe disease that requires hospitalization and disease that leads to death.
OK， 对于这个很严重的病呢，或者是死亡的情形呢，我们有非常好的一个果效。
The Moderna and Pfizer vaccines require 2 shots, 3 to 4 weeks. The second shot 3 to 4 weeks after the first.
这个 Moderna 跟这个 Pfizer 2个这个疫苗呢，需要打2次的，通常是3到4个礼拜之后。
and the Johnson & Johnson vaccine is a single shot.
Johnson 跟 Johnson 呢，这个只要打1针就可以了。
Right now, after someone has been vaccinated, 2 weeks after someone has received the second dose of their vaccination or the Johnson & Johnson vaccine, the body has had enough time to mount an immune response to offer full protection.
这个3个疫苗打完之后2个礼拜呢，它这身体上有足够的这个能力去防止任何的病毒。
At this stage, though we know that the vaccine, as I said, is very effective against preventing severe disease, we don't know the full details of how much it prevents transmission of disease.
虽然这个病毒这个疫苗呢，可以防止这个很严重的这种病状，但是它的这个究竟对其他的有效性，我们还不是很清楚。
For that reason, people who've reached full protection after vaccination will be able to do more things with lower risks, but are still recommended to follow certain public health guidance.
虽然这个两针都打完了，有很好的这个保护，但是你还是要照一般的规定，保持这个防止有另外的这个感染。
For example, the Center for Disease Control has recently stated that people who are vaccinated may meet together without masks inside.
譬如说，疾病防治跟控制中心呢，他们认为有些人已经打完了针，如果还在室内一起碰头的话。
However, when going out into public, to the store, out on the street, it is still recommended and required that people wear a mask and maintain a distance of 6 feet from others and continue to wash their hands. All the measures we've learned to do over the last year.
虽然室内可以有安全性，但是你出外的话，你还是要戴口罩，要常常洗手，而且要保持这个社交的这个距离。
Both the CDC and the governor of Washington State have also recommended that people avoid non-essential travel during this time until we learn a little bit more about the effect the vaccine has on transmission of disease.
美国的这个疾病预防跟控制中心，还有法州的这个卫生局都建议，如果不是必要的话，就最好不要去坐飞机旅行，一直到找到最有效的这个疫苗为止。
To go into a little bit detail about the differences between the vaccine. You may have heard that the Moderna and Pfizer vaccines are a slightly different type of vaccine than the flu vaccine, for example.
我们如果详细看这2个疫苗的话，这个 Moderna 跟 Pfizer 呢，跟那个普通我们的这个流感的这个疫苗呢，是有点不同的。
The Johnson & Johnson vaccine is a more traditional vaccine technology that helps the body to stimulate an immune response.
这个 Johnson 跟 Johnson 呢，它是比较传统性的，是帮助我们的身体来这个去制造那个预防的这个的疫苗。
I think it's important to mention that despite some differences in the approach to vaccination, most health experts recommend that people obtain whatever vaccine is most readily available to them.
不管是任何的这个疫苗，如果他们提供什么疫苗，我们就接受那个疫苗去打那个针。
Since all three vaccines have proven to be very effective in reducing severe disease, and since they've all been shown to be safe in extensive clinical trials.
因为这3种疫苗呢，都证明是非常有效，而且可以防止严重的病，而且是很安全的。
I'm going to turn now briefly to obtaining the vaccine and the process by which the vaccines are distributed.
OK， 我们想进一步去怎么样接受这个疫苗，还有他们是怎么分布的。
Because supply of the vaccine is limited, the government has empowered the states to provide vaccine first to the people who are at highest risk for contracting COVID-19 or developing complications from COVID-19.
因为这些疫苗是它的供应呢是有限的，所以政府呢是提供州政府有权利是给哪一些有高危险度的人先得到这个疫苗。
That list of eligible folks is expanding rapidly, and the hope and expectation is by May that it will be expanded to the general population.
这个有资格得到这个疫苗的话，已经慢慢扩大，就越来越多人得到，所以预计呢，在5月份，那一般的公众呢都可以得到疫苗的打针。
Rather than review the current guidelines about who is eligible, I would recommend the Phase Finder website through the Department of Health webpage.
至于现在是谁有资格得到这个疫苗呢？我请各位去看那个州政府这个卫生局的网站。
The link, the first link in the chat here is a link to that webpage in Mandarin. I believe it's available in simplified and traditional characters.
我相信这个连接呢是有中文的，那是简体字的。
This website will lead you through a series of questions that will let you know if you are eligible for the vaccine, and if not, will alert you when you do become eligible.
OK， 那这个连接呢会告诉你是不是已经有资格接受疫苗如果没有的话，它会告诉你，下一步应该怎么样，什么时候可以有可能性。
If you are eligible for the vaccine, the second link here is a link to the locations where vaccine is being provided, where you can reach out to schedule a vaccine appointment.
OK， 如果你是有资格得到这个疫苗要注射的话，他们有第2个连接，这个连接呢可以告诉你是哪一个地点可以找到，那么你们可以去申请。
We've talked a little bit about the production of the vaccines, the different types of vaccines, and the eligibility criteria for vaccines.
我们提到这个疫苗的供应，还有这个谁有资格的问题，还有不同的疫苗等等。
I'd like to address a little bit some of the side effects or reactions that people can have to vaccination.
那我现在要先跟各位讲一下关于打疫苗后的一些副作用。
In the clinical trials, all 3 vaccines were administered to tens of thousands of study participants and were found to be safe.
根据我们这个试验的测试的结果呢，有表示这个都很安全的。
And since that time, the vaccine has been given to millions more people in the community.
这个之后呢，这些疫苗已经给了这个成千上万的这个百姓。
Though the vaccine is safe, it is quite common to have some symptoms, a reaction to the vaccine, particularly after the second dose, and particularly for younger people.
这个疫苗虽然是安全但是他们还是有一些反应的，特别是中了第二次这个疫苗之后而且特别是年轻人
These are generally symptoms related to the body's immune response being activated.
这个主要是因为身体呢对这个免疫的这个刺激到这免疫的系统所以有这种反应跟这种症状。
They don't indicate that someone has gotten COVID-19 from the vaccine. In fact, it's not possible to get COVID-19 disease from the vaccine.
这个并不是说你得到了这个新冠病毒这种，而且不可能，因为这个注射疫苗你得了新冠病毒。
These symptoms commonly involve soreness at the injection site. Your arm can be quite painful, fatigue, some muscle aches, and possibly some low-grade fevers.
OK， 通常呢，你打了之后会觉得这个你打的部分会有点酸痛有时候会觉得这个肌肉会有点痛，或者是有点稍微发烧等等的情况。
The symptoms generally resolve in one day, possibly a few days.
通常这种反应呢是只是一天或者是几天的就过去了。
I myself, after the second vaccine, had a low-grade fever and spent part of the day, the next day in bed.
我自己打了这个第二针之后有一个这比较轻微的这个发烧，但是休息1-2天后就没事了。
So I was fine and able to return to work the following day.
所以第二天呢，我就能够回去工作。
The vaccine is really recommended for almost everybody.
这个疫苗的这个是建议呢，是每一个人都要去接受。
The Pfizer vaccine has been authorized for people ages 16 and above, and the other two vaccines for people ages 18 and above.
OK， 那个 Pfizer 这个疫苗呢是16岁以上都可以接受，另外2种呢是18岁以上的。
There have been rare instances of allergic reactions that may be attributed to a component of the vaccine.
很少有这种对这个部分的这个疫苗的这个成分有这个过敏的情况。
And people who've had a severe allergic reaction or an immediate allergic reaction to the first injection of the vaccine should not get the second injection without consulting with their doctor.
如果第一次的预防针的这个疫苗呢，如果有严重的这个过敏的反应的话就建议如果你还没有跟医生去谈的话，最好暂时不要打第二针。
People who have had a severe anaphylactic or severe allergic reaction to other things should be monitored after vaccination for a period up to 30 minutes.
OK， 如果你有这个很严重的过敏的话，你这个30分钟以后特别要留意。
And when you go to a vaccine facility, they will ask you questions to determine the appropriate amount of time for monitoring.
那个你们去打预防针的时候呢，这个疫苗的时候，他们会告诉你这个时间应该留意多久的时间。
Today, the state made the vaccine eligible to pregnant women over the age of 16.
我们本周呢，华盛顿州呢，对这个怀孕的妇女，如果是16岁以上，我们都建议去打疫苗的。
Unfortunately, pregnant women were not involved in the initial efficacy and safety studies of the vaccines.
但是我们做这个初步的这个测试检验的时候嘛，没有包括他们在里面。
Though experts don't believe there's any reason to suspect there'd be any harm from vaccinations, and the recommendation is that vaccines be made available, and women who are pregnant to discuss the risks and benefits with their doctor or obstetrician.
他抓医疗这个医生的这些专家们认为呢，他们不见得就是说这些有怀孕的人打了疫苗后有什么坏的结果，所以我们都建议，不过你们应该跟医生去谈一谈。
I'm realizing we're running up on our time. I want to make sure we have time for questions. So I'll pause there in case there are any questions, specific questions I can answer from the group, or Yvonne, if you have questions you feel I ought to address that I haven't covered.
这个我们的时间都差不多了，我想给各位有一点时间去问。另外Yvonne刚刚有没有要补充的没有？
Thank you. Yes. If anybody has a question that you would like to ask, you may unmute yourself and ask it. You can also put it in the chat.
OK， 很好。如果有任何问题的话，你们可以把那个打开里面的这个unmute 的部分打开。另外，你们也可以用这个 email 的方式提供给他们也可以。
Hello， 你听到吗？
听到。是的。
好，我想问你一下，就是说，打了第一针的时候，我本身发冷，这样是否继续打第二针呢？这是第一个问题。第二呢，就是假如我顺利的打了第二针的时候，我打的是 Pfizer， 我打完之后呢，怎么说呢？等到多少才有效？因为我现在想去 mammogram 和那个做那个手术，做那个 colonoscopy 和那个 endoscopy， 要等6个星期呢，或者4个星期才有效。你听懂我意思吗？
Yes. I have 2 questions. First one, after I take the first shot, I have chill. Should I take the second shot? And also after second shot, how effective will be because I have a mammogram, I'm going to have surgery soon. I have to wait 4 weeks, 6 weeks, or what do you think?
Okay.
谢谢。
Thank you for the question. For your first question, having had chills after the first shot, I think you should proceed with the second shot. That is a common side effect that's expected and happens in a good portion of people after the vaccination.
谢谢你的问题。关于你这个稍微发冷的话，他认为你还是要做第2次的这个疫苗。另外，因为这是普通的一种反应，而且疫区都会有的，而且不少人都有这种情况。
The types of reactions that make us concerned for an allergic reaction, and these are very rare, occur almost immediately after vaccination and certainly within 4 hours, and involve wheezing, difficulty breathing, and a red itchy rash on the skin.
OK 其实这个严重的这个过敏的话是很少发生的，通常它是立刻就有反应的，一般是在4个小时以内。 通常是有这个呼吸很紧凑啊，有呼吸困难啊，这些症状的。
And thank you for bringing up the question of the mammogram. We are learning that after vaccination, people can have a temporary inflammation of the lymph nodes, which is part of the body's immune system and is, again, an expected response to the vaccine at this point.
很好，你问另外一个问题是 mammogram 的事情，一般呢，这个打完针以后，有些人是有一些这个暂时性的这个发炎，淋巴性的发炎这样子。
But it can complicate the interpretation of a mammogram, and I believe that the recommendations at this point are to have your mammogram before your vaccine, if that's an option, or to wait. I believe it's 4 to 6 weeks after a vaccination before having a mammogram. But I would discuss the specifics with your physician in your particular case.
OK， 我的建议是最好你在这个接受疫苗之前呢，就做 mammogram， 不然的话，你注射第2次之后呢，4到6个礼拜再去做这个检查。不过我还建议你去跟这个专科医生谈一谈。
谢谢。你意思就是说
，Thank you。
第2次呢，打针之后要等6个星期才可以做 mammogram， 是吗？
So that means after second shot, I need to wait 4 to 6 weeks to do the mammogram, right?
Yes, I would say that's true for a regular screening mammogram.
Yes.
But if the mammogram is for some other purpose, that I would discuss that with your doctor if
Sure.
it's more important to have that done within that time frame.
Yeah， 对于一般性的这个 mammogram 的话，我是建议说4到6个礼拜。如果有特殊性的这个 mammogram， 我建议你跟医生谈一谈。
还有那个 colonoscopy 和 endoscopy 呢
？How about an endoscopy and colonoscopy? How soon I can do it?
I don't think that the vaccine should interfere with your ability to get that. I think you could have that done at any time around the vaccination. It's really the lymph nodes that interfere with the interpretation of the mammogram that's a concern.
Yeah， 我觉得这个肠镜检查、胃镜检查是不受影响的，也是没有问题的。就刚刚提到这个淋巴腺会影响到这个mammogram 这些呢，你要稍微留意一点，所以你这个可以去做的。
好，还有最后一个问题，我听人家说，他说，有的人告诉我，他说，假如你检查之前，应该喝一杯温水，和要吃饱才去，那会减轻那个反应。我请问这是正确的吗
？Last question. I was told before the vaccine, if I drink warm water, a cup of warm water, and also have full meal, it'll be good to prevent any symptoms.
I think that's generally good advice to stay hydrated, eat a healthy diet, and get plenty of sleep around the period of the vaccine.
我觉得这个是很好的建议，就是喝杯水，足够的水，然后要吃的要吃饱，也要吃得好，而且有足够的睡眠，那当然对你都有帮助的。
We don't recommend that people take medications like Tylenol or ibuprofen before vaccinations in anticipation of muscle pain or discomfort.
OK， 但是我们不建议这个接受疫苗之前呢吃 Tylenol、ibuprofen 这一类的事情以为说防止以后的痛的防止痛的话，我不建议这样做。
because theoretically there's a concern that those medications might interfere with a full immune response to the vaccine.
因为我们觉得这些药呢，对你这个免疫这个系统是有影响的。
However, if people do develop bothersome muscle pains or low-grade fevers after vaccination, I think they should feel comfortable to take those types of comfort medications if it would make them more comfortable.
OK， 假使你打完针以后，你真的有感觉到有一点这个肌肉痛，或者是这个一种发烧之类的话，你们可以去吃那些这些这个 ibuprofen 之类的药。
I myself used ibuprofen and Tylenol on the day after my vaccination because of the fever I had.
我呢，因为有打完之后有发烧，所以我就吃了这个Tylenol 跟 ibuprofen。
好，谢谢。
Thank you.
All right, well, we are at time. Thank you all very much for attending today, and many, many thanks to Dr. Darnton who gave us this information.
好，我们时间到了，非常谢谢各位的参与，也特别谢谢Darnton医生，谢谢您。
Okay, thank you all. It's my pleasure. 谢谢你们。
谢谢你们，这是我的荣幸。
Goodbye.
再见，谢谢。